Okay, welcome everybody to the fourth Digital Health Village webinar. Today we will have two interesting speakers who are going to look into the drivers behind healthcare digitalization. First, we have the CEO of Helsinki University Hospital, MD and PhD, Juha Tuominen, who will be talking about digitalization from the perspective of a large hospital. In the second part, Mrs. Annika Tanttinen from KPMG will be talking about the value drivers in healthcare. During the presentation, we will address your questions after each presentation. Please use the question panel for your questions. But now, please welcome Mr. Juha Tuominen.
Thank you and hello to everyone. I'm very pleased to be here to present to you, all of you, what we are doing at HUS is Helsinki University Hospital. And shortly, before I go into my presentation, I go through what I'm going to tell you. What I'm really trying to convince you is that the digitalization is not just a word in HUS strategy, but it already has given us quick wins, and I'm prepared also to show you some of those quick wins. But first, I will introduce you how big and what kind of healthcare provider HUS is. Secondly, a little bit open the idea of the digital services, what we are aiming to, and how we are using or how we want to use digitalization in order to transform the hospital. Especially within this short period of time, I try to little bit deep dive to research abilities, data. Also, the fact that we are a manufacturer, we have an ISO certification to produce these services and apps for the services is an important thing for the hospital like us. And especially what is the most important thing is that we are for patients. This is a hospital setting, secondary and tertiary care, and the ultimate final customer of ours is patients. So this has to be customer oriented, and the focus has to always to be on the good of the patient. Who is a national? Well, it's a local South Finnish health service provider. We have 5 university hospitals here in Finland, and we are at most the biggest one, and we take care of 1/3 of Finland's specialized healthcare in terms of secondary and tertiary care. We have nearly 3 million patient visits, 27,000 employees, and 23 hospitals. So we are broadly presented here in southern part of Finland, Helsinki and its neighborhooding, over 20 municipalities which are here. The number of individual patients who we treat is nearly 700,000, and if you remember that in Finland we only have a little bit more than 5 million patients, so 5 million people living in Finland, so 700,000 of them is using our services, and we see that as a huge asset for us, an asset in terms of data and scalability, which are the key enablers in the transformation. Well, in addition to local services, we also serve as a nationwide provider. As the most specialized university hospital, we do all the organ transplantations in Finland. Most of the severe burns are taken care by us, and several other very highly specialized medical treatments are done So the nationwide responsibility also is really a responsibility. We are proud of the responsibility, but also it means that we have to be really efficient and good, and we have to prove that we are the best in Finland, because all the others, they trust us, and healthcare is built really on trust. But not only as a service provider, we are a big research facility or organization. Together with university, Helsinki University, we do highly recognized research, good impact factors. So at least I'm quite satisfied of it. Over 3,000 published scientific articles a year, and also we are responsible of physician education. So a lot of physicians and other specialists, they get education and their licenses in our premises and in our settings. Well, that was who's in couple of slides. But how then this big organization with this 3 million visits, how we are really trying to look forward, to see beyond the others, to see tomorrow and do the change. And there we have quite a new strategy. And in this strategy we have we have 5 targets. But if you really look thoroughly on these targets, so 4 of them are real targets or goals, and one is a way or means to really to catch those targets. And I will shortly go through these targets, because it's important to understand that digitalization is not a tiny bit of the thing what the hospital is doing, but digitalization is it's involved in everything what we do. Firstly, we have one of the targets is to be we have to be proven to provide best medical care and service. And of course, every one of us says that we want to do best medical service, but here the proven, so measured, that's the area and idea where we point out. So we really have to prove it, and to prove it means that we need numbers and we need data, and we have to compare the data and benchmark the data. And the only way really to get data in so big organization as us is a structured way to use digitalization from the hundreds of different sources where the data is catch and caught. So especially the way to gather the data and then to report and show the data, all of that needs digital skills, and is a transformative way to look to the hospital. Secondly, a lot of people work here, so this is a working place for 27,000 people. The user experience of our workers is important, and not only those who work with us, those who do research with us. The research, especially now in the corona times, we see that the data is really the backbone and search of the research. And if you look what happens there in the scientific market, so a lot of studies are coming which are delivered from the acute data what we get now, and that's also where we really put the emphasis on. So digitalization is the way really to use and catch the data in order to use to get good research. Thirdly, of course, as we are a hospital and we have a responsibility, we have to promote health. But that must be health. Health promotion must be done in an efficient and effective way. We all have a lack of money, especially we will have more lack of money after the corona epidemic has gone over. And here, the benchmarking, the visibility, the transparency is really important. And also, in order to get good quality, we have to structureize the things what we do, and that gives less variability. And when there's less variability, the quality is better, but also the cost goes down. So here also gathering data, using data, and automizing our systems and patient flows gives us less variability and more scalability. The fourth area is responsibility, and that means mostly nature things and the green things and the environment things. Without the transparency of like carbon emissions or what kind of cars we are using or how much trash we put on the bin or how much we use electricity, without that transparency we really cannot gain any results. So here digitalization is also a tool in order to get better results. And fifth, then, well, that target is like a way to operate and to get results from these four previous, which I showed you, but also the way to communicate with patient. And customer driven here is the word, and also the change. And what the change means, it means that we have to do things differently than earlier. And of those 3 million visits which I showed you, many of them can be transformed to kind of mixed visit or mixed care paths, and I will go further on to those later. So maybe you already caught that our perspective is of course on cost savings. Digitalization gives us possibility to do the benefits of scale, reduce manual and reduce double work. But really where we want to put emphasis on is better quality. So the bad pathways what we do for patients, they are not anymore individual. Typically in healthcare, physicians or nurses, they give their knowledge for the patients, but it's always a little bit individual thing. We have to get more structure on that, and with the structure we also get the quality, and with the structure we are able to do it in a more automatic way. And when it's more automatic, it typically is also more cheaper. So the pathways are really the key thing where we are working on. And when those pathways, digitalization gives us possibilities to automate reminders, checks, workflows, and also to add artificial intelligence on top of that. And what's also really important is that we can involve the patient, giving them responsibilities and to show them and to open their care more visibly to also to the patients. And the third thing, of course, is that with these new tools we can lower the barrier to get access to healthcare. So we have a lot already web therapies. We started this digitalization of care paths already over 10 years ago from the mental therapies. There it is now really widely used, and we have very good experience on it, both on the results and quality results, but also in the means in the cost way. So the costs have gone. It's very rare in healthcare, but here the costs have gone down even. And of course, some of you might question that if you have heard that we are transforming also to the Epic patient management and reporting system. So where do we need another strategy? Isn't it that everything? But no, it's not. It's only a part of this. Epic cannot give all the things what we need. It gives a lot of important part of this, but we have to on top and in addition to Epic to also to build a lot of other services on this. And how then we are trying to cope in this overwhelming challenge, because it is an overwhelming challenge. Digitalization started 1970s from the laboratory results and has gone further and further and further in hospitals. This is we have a bunch of different kind of technical innovations here, and it's difficult for the staff to really to fit into the new tools, and the user experience is really important in order to gain the best talent to us to work as medical staff and such. And our answer is digital health village. The village which we, as I told you, we started from the with the psychiatry and mental services already 10 years ago. So now we are on that path. We are quite far already. The platform for the health village has been proven to be really customizable. I would also say that it's global, but for us, of course, it's not only local, working in Helsinki and Uusimaa area, but also in whole Finland. And with that platform, we can bring together professional information, and of course, the main important thing is that we can really serve the patients in the way that it's easier for them to access the services. It's cheaper for us, and we mix the physical visits and digital visits together to one service. And how the evolution has gone. Well, first, of course, we just were thinking of the money things and scaling, and we thought that we have to decide the hospitals, but we understood the power of data, and with that power of data, we've been able to do really the ecosystem part here. And on this slide, on the right hand down corner, you see our data lake. We have to call it as a data lake because we get a lot of data from many sources: electronic medical record systems, genomics, biobanks, quality registers, imaging systems. So we all that data is dumped to the data lake, and we have abilities and tools to do mining there. Some kind of a thinking process prior we start to then make different services for different sicknesses and treatments, and we have a kind of structured way here in the database platform to really to work on them, to make applications, and that leads really to different digital treatment paths. And the nice thing here is that this is done by clinicians. So the clinicians are really involved in this, and in order to get the transformation and the change to really true, so this cannot be given just as a tool and to the physician, but they have to be really involved in this by themselves, and they have to really get the idea, and this has been a treasure for us in those ways. And here I have a couple of examples of those 100 pathways which are really in use. In nephrology, we have a care pathway for neuro. Sorry, this is a typo, but we have in nephrology one of our pathways. We have in neuropsychology, we have a pathway. We have a dialysis pathway, headache, diabetes, asthma. Very big burdens in healthcare, especially if you think about diabetes, headache, or asthma. They are very broadly, unfortunately, shown in the population and very expensive. And there's also a really big possibility to do prevention. And this is so this is kind of mixes also the abilities to prevent and then to take care and to treat the patients. But in the beginning, I promised you that in this story or presentation, I try to convince you that we already have quick wins. And when it already was planned that we will give this presentation to you, so then the corona was not here, but this changed the things what I wanted to tell to you really, and I wanted to put an emphasis on this corona epidemic, because within this epidemic or pandemic, we also we all have been in great hurry. We have had to really cope on the new things in a very short period of time. And for us, digital tools and digitalization has been a really important tool in coping Corona. We've done Corona bot, an assessment tool of likelihood of infection, very widely used in Finland. Mental support programs, very widely used. Service bots, giving how and where the services should be given, and a sampling control system and automation even for the patient to go to the sampling. So without these tools, our results would have been much worse, and we would have needed a lot of more personnel to do this. And so the technical tools have been enormously important. But the nice thing is that we could use the tools which were used in order to from the platform in order to do the different services. So they really enabled us also to attack this Corona pandemic very rapidly. So this is what I wanted to tell you, and I'm ready for questions. Thank you.
Okay, thank you very much, Juha. That was an interesting presentation. So as promised earlier, now it's the time for questions, and I probably, I can remind the people that probably came a bit late to the presentation, so that please use the question panel for putting out your questions. I will be then asking them directly as they appear. But in the meantime, before I go to the questions there, I have a few of my own. So Juha, in your presentation, you mentioned the Corona sampling control and infection monitoring software in the last slide, basically. Can you elaborate on the benefits of that service? What did we achieve with that?
Well, of course, we all were really in hurry on both of testing and getting the right patients to the test, and also understanding where the patients come from. So when giving to the patients, firstly, the transparency and possibility to get answers from computerized system, automated systems, it freed personnel to other services. We could also do a lot of monitoring and understanding where the pandemic is coming from, and then we could turn that to services to patients to give algorithm on how to them to find right contact, and that kind of funneled patients to us. And finally, also we could automate the way how those really who fulfill the criteria, they will also go directly to the testing facilities, so that we could really skip a lot of people out there, do really important and rapid and good reporting, and later on, when we were able to also to combine a lot of information, of course, according to all of the rules of privacy, it made us much quicker in responding to the challenges.
Okay, thank you. Okay, there's another question which is basically related on the digitalization in general. So people are expecting that there must have been some bumps on the road, so it hasn't been all that smooth. So what do you think that are the key points that our audience should bear in mind when deploying the digital services?
Well, I've been here who's working now 1.5 years. Then I was prior to that I was 9 years in another provider, also in healthcare, in private sector, and prior to that I was in who's. So I've seen the start here, then I was a little bit away and came back, and the problems are same everywhere, and the main problem is lacking the focus. Absolutely, because there are a huge amount of opportunities. One has to constantly try to squeeze them, to focus on them, and to understand what we are doing, who we are serving. Are we serving a couple of physicians? Can this be scalable? Are we serving patients? And typically, we have all been doing kind of a loose apps which are scattered here and there, and we have to be able to understand that we have to combine that to the patient flows, and there are general things in the flow which can be scaled to several of the services. So this backbone has to be scaled first, and second, like here with the health village. So that is a platform really which where the backbone is really solid. Still, it gives abilities to do it, to localize it to different services and different sports, if I would say, different specialties. So the scalability is the first thing, and the scalability comes from the focusing and narrowing the things. So that's a real issue.
Okay, thank you. I'm looking at the clock, and I think that we will be now giving the floor. Oh, there was still one question. Okay. Let me see. There is a question. One more question. Who's planning to work with private companies in a more collaborative, structured, neat, and open way? This pandemic has really shown the need for public-private collaboration. So can we expect changes in this? And what is the message to private companies looking to partner? Thank you.
Especially, well, this pandemic has really shown the need of collaboration. Especially here in the pandemic, what has been really the need is the need of information, and because the private sector has carried a big role also in testing and working with the test. So well, I really have to say that the important thing is that the way how the data flows and the rules should be first discussed in the society and in all the countries. Even we have had some problems with or it has taken too much time to really do the handshake, and there are a lot of kind of not only not technical issues, but maybe legal issues, and best they have gone over if we know each other. So the whole thing in leadership is that know your friends and know them prior the problems come. So we have to do more communication with each other.
Okay, thank you. I think that we need to move forward, but Juha will be here throughout the webinar. So basically, if you have more questions to Juha, we'll still have the time to answer or ask them from Juha as well. But at this stage, thank you for the Juha so far, and now I will be welcoming our next presenter, who is Mrs. Annika Tanttinen from KPMG Connected Enterprise Unit, who also happened to lead the evaluation of Health Village when it was still in the very beginning and in the developments. And Annika has really a long experience in developing and deploying new operational models in healthcare. And in her presentation, she will highlight the common value drivers for patients and hospitals when utilizing digital solutions and platforms in patient care. So please welcome Mrs. Annika Tanttinen.
Hi, hello. I'm very happy to be here and very glad to talk about the work we done together before. Let me see. You should be able to see my presentation. Is this correct?
Yes, we do.
Good, excellent.
But by the way, you are not, okay, now it's better. It was not in the presentation mode, but now it is. Thanks.
Yes, so thank you for the introduction. So I will talk about about the results we achieved together with the HUS professionals, and also how we did the work. I suppose, or I believe this is highly interesting to many of you. And as Juha said, the focus, to identify the focus is very important. There are so many ideas and well-meaning initiatives, but the ones that truly bring the benefits are the ones that are really carried through and accepted both by the users and by the professionals. So so this is very important. So how when we started the work, of course we had the initial discussion how to find our focus in doing the analysis, and at the time I think HUS already had tens of functionalities and tens of care paths in use. So we wanted to, of course, find a, let's say, sample that was broad enough, but wasn't exhaustive. And also that we wanted to capture different aspects of the actual operations. So in the patient care pathway, you can see here the different stages. Obviously, this is a model to illustrate and simplify the actual happenings and what is happening in the hospital and in the care. But this was quite useful in doing the analysis, even though we allowed flexibility in the actual calculations and in identifying the quantitative benefits. We categorized the care paths in three different categories. One was the operative care. Operations, very limited in duration, are relatively simple, usually low risk, and the patient will continue normal life after the operation. Hernia surgery was chosen to be the one to be addressed there. Then we had a number of chronic diseases, obviously very different in nature. This is something that the diseases that you have to live with for the rest of your life, typically. So the whole nature is different. You just try to find cure for the symptoms and try to live your life as normally as possible, or make let's say the daily life easier. And the diseases may have different phases in when they are developing. Then we have the therapy and training care, and in this category, the care paths usually require a high amount of patient involvement. Many of us are familiar with the weight loss topics, so this is about your changing in your lifestyle, learning new behavioral patterns. So this takes time. It's very important, but it takes time, and you need encouragement and help and information, non-biased information and support to make it happen. Then there may be diseases like headaches in children that the whole family is actually the party that is to be targeted. The whole family typically needs to change the behavior. The whole family is ill, and everybody has to be involved. And this is also usually these headaches in children are related to the lifestyle issues. And functional ability, you're all familiar the topics there. And underneath you have you see the technical platform, the elements that can be leveraged across a number of care paths. And this is what Juha was talking about as well, that these are, let's say, functionality that is implemented maybe once, and then it's more or less copied or leveraged when building new additional care paths. And obviously the cost benefits in the later care paths are significant. So there is ID management, diaries for symptoms, for chats and calendars, common functionalities, for modules for IoT device integration and similar. Many web, let's say, applications and web stores that you may use follow similar type of structure. Here you can see the 8 pathways that we analyzed. And as I explained, they all of them illustrate different situations in the care in patient's life and in the duration. Some are short in duration and some take years. And around these care paths, we then work together. Here you can see the many different types of roles of whose professionals that were involved in the work. So you can see the social work coordinations, therapists, physiotherapists, team leaders, project managers, professors, various types of professionals, even business controllers, like Juha mentioned. Money is a topic, unfortunately. We don't have unlimited funds here. And when we were working together with such a broad set of people, this is highly interesting, but still everybody had their own point of view and their own mindsets. And we were thinking about the employee experience, how people experience their own work, what is functioning well, what could be improved. But then also how does this look like from the patient point of view? If you're ill or you're suspected in having a serious disease, so that you come to the hospital, your, let's say, mental capabilities may be somewhat limited and you're stressed. So how to help the patient through that process? And then together we decided to use these customer journeys, illustrations, where we describe each of the touch points. These are the encounters between the patient and between the professionals. What happens there? Which channels is used? Is it face-to-face? Is it over the phone? Is it on the online channel? And what functions well? What are the, let's say, tasks and activities that are and can be eliminated? Is it the job of a nurse to write letters or to chase information or act as a secretary to book appointments? Or is it the task of a nurse to actually support the patient in this stressful situation and help him or her through the process? And this is how we then identified the benefits, qualitative benefits, what works better, what helps the patient, what helps the organization, and what makes the work of the professional more, let's say, meaningful and purposeful, like we say today. Most of the people, of course, are there to cure people. It may sound fashionable or very grand, but this is at the end of the day what it is. And this is how we work then together with the teams, and described all of the 8 care paths and made also financial calculations and models what this could mean and means in monetary terms. Here you can see the now in this case 7 value drivers behind these let's say exemplary care paths, and I believe similar value drivers can be found behind the many other care paths, even though they may have different headings. Number 1 is the decision support and standardized workflows. Some of us may not like the standardized as a word or any standardization that we are here dealing with people, but still, if this is not, let's say, Taylorism, but this leaves flexibility to treat the individuals as individuals. But the benefits of the standardization is, I think Juha referred to this as well, that it helps to find elements to be automated. It helps to find elements to create checklists for, that some things are not missed, or it also helps to eliminate some tedious administrative type of activities. And then the data is also recorded, and the visibility and the transparency to the operations at the hospital is improved, and the decisions are easier to make. So this gives better support for the decisions. And also, if you think about the current situation where the capacity is, let's say, somewhat pressed or even overflown in some occasions, that the understanding how much time and effort and personnel is consumed in each of the activities helps to allocate the resources optimally as well. And same applies, of course, facilities and equipment. Then we have the more proactive and targeted care. And here, obviously, the let's say the digital care paths help the patients prepare better for the actual doctor visits, so that once they met the doctor, it was clear, and also already there was a preliminary analysis. What are the pain points? What are the symptoms, and what are the, let's say, top 3 topics that is bothering the patient the most? And the discussion and the treatment could focus on those things. Also, if the patient was already, let's say, enrolled to the digital care path, his or her condition could be monitored, and then this, let's say, alarms or early signs of things going wrong direction, they could be contacted and asked, okay, what is going on? Are you feeling worse today? And now in this way, also if some, let's say, unnecessary doctor visits could be avoided, the specialist could free time for more urgent cases. And also if the, let's say, Parkinson's disease was in control, that the next visit could probably be postponed, and not just to follow standard path, but to be optimized and tailored for the patient situation. And there would be then a time for, let's say, patients that are more needy. Then we have there, I need to move my panel here. Better coordinated care and unified patient views. This is obviously based on the improved data and visibility of the patients as a whole. In some of the care paths, let's say, professionals involved in the care were coming from different units. There could have been a specialist in that particular disease, or treatment area, or nurses or social workers, or if the issue was multidisciplinary. So then these teams could be more effective when working together. Then we talked about the online, or the role of the patient, and one of the clear benefits here was that these care paths provided also better visibility to the patients of their care, and how they could take more responsibility, help themselves, and they could have access, or have access through this health village to unbiased professional information, and not something helpyourself.com level of information, but do this, don't do that, and this is how in your particular condition you should behave, even, and so forth. How could you help yourself to cure sooner? And then they had also a sense of control over the care process. They could check what has happened. How did I feel last week? Or am I imagining that things are now worse or better? What is happening next? When is my next appointment? What information has the doctor given to me, and so forth? So all of these increase the patient's sense of the that they had control. They were in control of their own treatment and getting better and healing. And as a result, all of the resources were used more efficiently. Also the patient's time, but also at the hospital, because of the let's say more streamlined and thought through care paths. Here you can see the quantified benefits. Yeah, so On the horizontal axis, you can see the benefits for patients and society. And on the vertical axis, benefits for the service provider, hospital in this case, and professionals. And the bubble size indicates the number of patients on that care path. So the care paths with expensive treatment and the chronic diseases, even though the number of patients was low, the treatment price alone increased the total savings a lot. So, for example, home dialysis is high on this chart, but then obviously care paths like functional ability or weight loss, because of the high volumes and the consequential, let's say, implications and issues and cost drivers, bring the total benefits or increase the total benefits quite a lot. But this type of illustration may help you also to find the focus, prioritize your actions. What is it I would like to achieve next? What is it where I should put my focus next? Then in many many cases, we talked about the platform, common elements of the platform that can be leveraged across multiple care paths. But then it's common knowledge from many other industries that there are these platform effects and positive circles. So once you make the initial investment, create the platform, and then start building on it, one thing lead to another. You get more functionality on your platform, you get more patients on the platform, you get more ecosystem partners to your platform, you start collaborating more with private operators and so forth. So this is self-enforcing positive circle. Like, for example, the palliative care path, they estimated that they will have tens of ecosystem partners, if not hundreds. And the question was how to incorporate those parties to this, let's say, integrated care team to make the patient's life as good as possible. That is all I have to say today. I'm very glad to answer all of your questions and to the best of my abilities.
Thank you very much, Annika. Okay, and before we go to the questions from the audience, I have one of my own. I was thinking that do you see kind of different strategies in applying digital solutions in healthcare in different countries? Is it basically how uniform is it, let's say, across Europe or even in a broader scene?
Well, I think that of course, the more advanced nations use digital solutions more, and if there's high penetration of, for example, mobile devices and so the utilization is higher. And now during the COVID crisis, the countries and the parties that have already been using digital solutions have been in better position. Any let's say ad hoc or quick implementations usually don't lead to good results. But there are a couple of common nominators. What we see is one, or actually quite a few, but from the digital point of view, one is this what we call digital front door, that the patients first tend to access the services and information through a digital channel. In some countries with, let's say, lower penetration of mobile devices or in internet connectivity, they also utilize call centers and similar, but of course there are digital tools in place. Also the scaling up of the care in this situation and let's say monitoring the situation with the help of digital tools to have command centers. It's actually a military term, but to be aware of your situation to identify or know your resources and capacity and to allocate that optimally, and how to manage these flows of people and potentially viruses. So this digital front door, scalability and command centers are, from the digital point of view, very typical.
Okay, thank you. A question from the audience, which is basically, to what extent do you think that this project could be economically sustainable without public aid at 50% or more? That's basically how it's framed. So I think that to phrase this question is that basically, do you believe that the project would not have been possible without in a kind of private context, or is relying on public aid?
I think it's all about volumes, isn't it? I haven't calculated that in Excel sheet in exact numbers, but if I remember correctly, on the top of my head, I would answer yes, since the yearly savings here and benefits accounted in tens of millions, and this is only a care paths. We are not talking, and now who's using tens or hundreds of care paths. So, but obviously, if you think about the care as such, digital is only one dimension of it. But my working hypothesis would be definitely yes. But obviously, this is a relatively easy exercise to calculate through or estimate.
Okay, thank you. At this point, I would like to invite Juha back to the session as well, because some of the questions seem to be more targeted towards Juha. Okay, actually, related to this economical question, again, there is a question related to penetration rate. So how is the penetration rate, or within 1 year and 5 years horizon? I'm not quite sure whether this is relating to our expectations or what has happened, but I think that if you can give some idea on both, basically what is where we are at and what we are expecting to happen.
Well, a year ago when I came to this hospital district, there were like 27,000 different identified people in those care paths. So they were really getting treatment. However, in addition to that, there were, we know that I don't have the exact number, but it was over 1 million kind of hits. So because we have two levels of services here, we have these care paths which really are part of the expert services and like physician visits, and secondly we have the kind of self-educated part. So both of them are used, but especially, of course, now we are looking forward to seeing the number of this over 25,000 to increase. And what we have seen here is that during the corona pandemic, that was kind of a unfortunately, it was free advertisement for this service for our professionals, because this help. It's mostly the professionals who they have to take this in. And the patients are easier, so the professionals have to do transformation to their work routines, and they don't have time to take anything extra. Anything extra what they take, it has to be kind of changed to other minutes there. The visit is as long as it is, and this now they have learned to use this. So I know that they are in tens of thousands, but I don't have more exact numbers yet. But the reports coming from all the specialties are really promising.
Thank you. There's another question that how were patients involved in the concepting process, and how are patients? Wait a second. Is there any more? perceiving the treatment. I think that this is basically the first part could go to Annika, because you were interviewing the physicians, and you know how it was done at the time, because it was basically at the time when the services were being built. And I think that then basically the second part would be both of you, how the patients are perceiving the services. So Annika, if you.
Yes. The of course the patient feedback was very crucial for the whole design. If you like I said, there are so many good meaning or well-meaning digitalization ideas, but only the ones that are actually implemented and used bring the benefits. And these, like you have explained, these paths are utilized both by the professionals and by the patients. So the patient feedback is crucial, so that the entering data is easy, checking out the appointments is easy. It's easy to access your own data and so forth. And in Finland, we are very fortunate to have very, let's say, digitally savvy nation as a whole. But obviously, in some cases, if your condition is, let's say, very critical, then it's you handle the whole treatment differently.
Okay, thank you. I'm still, probably, I think this is probably the last question, because it's basically, I would probably address this to Juha now, and because we are running out of time, we have 4 minutes to go. So how do you see the patients perceiving these services? What is the feedback from our patients? How patients are reacting to the digital services in general?
Well, as I told, the first experience is from the mental services, and then we have done a quite thorough questionnaires or tried to get better understanding on that, and there we especially see that there are patient groups who really favor these kind of services. Also the same with many other services. So the feedback has been good. However, I do have to say that we all are in a starting phase, and how I'm trying to encourage my people is that we have to do a pilot phase, and we have to do second rounds and third rounds, because these are not ready yet. We get some kind of services, then we learn more, and we understand from the physician's part and from the patient's part much more. And there, unfortunately, I have to say that this COVID has been a quick kind of teacher for us, because there we tried to spread this all over the specialties, and not only those who really want it, but also those who were a little bit hesitant. So the more experience they get, the better it goes.
As in, yes.
Yes, Annika, please go ahead.
Yes, I said as in every activity, and this is a typical agile approach in developing services.
Right.
So you iterate and you build on that.
Exactly. I think that this is it now for us for today, and thank you very much for our audience, and thank you very much for our excellent presenters. Thank you, and see you in the next webinar. Thank you.
Thank you.
Bye-bye.